Welcome to the series seminar video tutorials Germanische Heilkunde by Dr. Rutgerd Hummer, MD. My name is Helmut Pilhar. I am the father of Olivia, and Dr. Hummer's appointed lecturer on Germanische Heilkunde, theory. This video tutorial is about the fourth and the fifth biological laws of nature. The fourth biological law of nature, the ontogenetic system of microbes. The topics discussed are vaccination, immune system, contagion, epidemic. Which, from the perspective of Germanische Heilkunde, turns out to be superstition. The fifth biological law of nature, the law of understanding any so-called disease, as a part of a developmentally understandable and sensible biological special programs of nature. The quintessence. It heralds a paradigm shift in medicine. Where do we have to start therapeutically? With the symptom? Or with the cause? In nature, good versus evil does not exist. This division is religiously motivated. Nature always does something meaningful. The objective is to understand symptoms such as pulmonary tuberculosis, night sweats, body odor, sagging breasts, hypothyroidism, drying up of salivary fluid, cellulitis, scar keloid, lymphoma, and so on. We can lose the microbe phobia and the fear of cancer. Not by faith, but by knowledge. You will learn more about this in the approximately 1.5 hour seminar video. Ladies and gentlemen, a good day to you. I welcome you to our seminar video tutorial on the Germanische Heilkunde by Dr. Rutgerd Hummer, MD. The topic today, the fourth and the fifth biological laws of nature. This fourth law is the law of microbes. There are three major groups of microbes. Fungi are the oldest type of microbes. Of bacteria, there is an in-between group, which includes the fungal bacteria or mycobacteria. With the third group of microbes, the viruses, we have to put a question mark next to the group, because viruses are merely a hypothesis of Louis Pasteur. To date, there is not one photographed HIV, polio, hepatitis, or measles virus. Dr. Stefan Lanka has even managed to get this fact confirmed by the German Supreme Court. Specifically, that there is no valid proof of the existence of a measles virus. Of course, it is difficult to prove that a virus does not exist, because it's difficult to prove the non-existence of anything. Can you prove to me that the devil does not exist? You have no chance. But if someone claims that the measles virus does exist, he must provide proof, which does not exist. It's almost certain that there are no viruses at all. In theory, one imagines the virus as a protein molecule that supposedly latches onto the DNA, and copies itself by cell division. That is how we're supposed to imagine the virus. Therefore, to stop these viruses from copying themselves, one would like to prevent cell division. Take AIDS for example. AZT is given for AIDS. AZT is a cytostatic drug, given to prevent cell division. The average half-life of a human cell is about 7 years. This chemotherapy kills every cell as it divides. That's the whole point of it, to stop the virus from spreading. In 7 years, you would be nothing but a skeleton. This therapy is deadly, to be sure. There is almost certainly no virus at all. Neither hepatitis nor polio nor any other virus. A bacterium and a fungus are independent living beings, each with their metabolism. And we are completely populated with these microorganisms. Bacteria and fungi are in us, on us, and around us. The virus, however, is not even a living being in theory. It is neither alive nor does it have a metabolism of its own. Of course, something that is not alive can't mutate into various other variants of itself. In theory, this is not possible. That, for the time being, is the introduction. Just as we have to understand the history of development to have a complete understanding of medicine, we of course also have to understand microbes from our history of development. From this perspective, the fungi, the oldest microbes, are responsible for glandular tissue. Fungi and fungal bacteria are responsible for the gland-like tissue. For connective tissue, it is the bacteria that are responsible. But for the squamous epithelium, the red group, which type of microbe is said to be responsible? Which microbe is responsible for, among other things, the common cold? Nasal mucosa. Squamous epithelium. Or jaundice, polio, hepatitis, the liver bile ducts? Squamous epithelium programs and polio, or other functional failure programs? It's assumed that all these programs involve the virus. But, as mentioned, the virus almost certainly does not exist. A microbe would never change the germ layer tissue to which it belongs. So, a fungus, for example, would never affect a connective tissue or a squamous epithelium. You can see this very well in pulmonary tuberculosis. The cause of pulmonary tuberculosis is a fear of death, a program of the yellow group. The biological sense in this particular program is in the active phase, the cell division of the pulmonary alveoli, which are the cells that make gas exchange, putting the oxygen in the red blood cells. This special program helps one solve a death fright by providing more oxygen, so one can escape from a deadly enemy. Without food, you can survive for weeks. Without liquid, days. But without air, I die immediately. That is the fear of death association. Therefore, nature helps with the fear of death in the active phase immediately, by increasing cell division of the lung alveoli, to be able to take up and utilize every air morsel, so to speak, optimally. If I am able to successfully outrun the deadly enemy, that is, to solve my fear of death conflict, then my brain switches on the fungal bacteria in my lungs. And as with all programs of the yellow group, the now no longer needed pulmonary nodule or growth is decomposed tuberculously, necrotizing, decaying. And like any patient in the healing phase with tuberculosis, I often cough out real tumor chunks, and I cough up blood. What one coughs up can only come out through the bronchial mucosa? There is no other exit than out of the mouth. But the bronchial mucosa are in the red group. There is pulmonary tuberculosis, but there is no bronchial tuberculosis. Even though the microbes must slide en masse over the bronchial mucosa, there is no bronchial tuberculosis infection. And in no instance do the fungal bacteria attack the squamous epithelium. They stick strictly to their tissue boundaries. So, they can't be that nasty and highly contagious germ that we fear. On the contrary, we need them as our surgeons of nature. The old brain tissues do cell proliferation in the active phase. The yellow-orange striped group creates a lump in the breast. Again, the biological sense is in the active phase, to be able to solve the worry about the child, with more breast milk. Once the child is healthy, the node is tuberculously degraded, the fungi and fungal bacteria are instructed to do so by our brain. The tumor is gone at the end of the healing process, and you are healthy again. Even according to conventional medicine. You have your normal day-night rhythm again, and you are healthy again. I need the fungi and the fungal bacteria as a surgeon, to clear away the tissue that is no longer needed. Let's say the microbes were not available to us in the healing phase, for example because of overhygiene. The pulmonary nodule will remain. Then no one can do the work for us, and consequently nothing can be cleared. Thus, the tumor remains, but it's an inactive tumor. Dr. Hackethel spoke of pet cancer and predator cancer. Predatory cancer is the evil one. It has a cell division, and it metastasizes. The pet cancer, that's the benign one, it doesn't budge. It stays as it is. So, at what stage would he call the pulmonary nodule a pet cancer? When the tumor doesn't get cleared by microbes. But the patient's quality of breath is much worse than if the pulmonary nodule had been cleared by microbes. A healing phase without microbes is never good. So it is with all the tissues of the yellow group, such as prostate cancer. In the active phase, a prostate program makes cell division, which is also the biological sense. It's to impress the female by being able to produce more ejaculate, look how good I am, come back to me. Then in the healing phase, it is degraded tuberculously. If this man doesn't have the necessary microbes, the tumor will remain. And under certain circumstances, his problems with urination will also remain. Now, in the orange group, that is the connective tissue. Holes or necroses develop during the conflict active phase. This also happens in bone, musculature, tendon, and cartilage tissue. Then, during the conflict resolved healing phase, the bacteria help fill these holes again. Take a boil, for example. The squamous epithelium ulcerates in the active phase and is repaired under swelling, but without microbes. Because viruses do not exist. Regardless of what kind it is, the microbe always works only on the command of a conflict resolution, which is called vagatonia. We always have the microbes around us, on us, and in us. You are probably sitting at a table right now. If you take a swab of that tabletop, you're guaranteed to find microbes there too. So we are indeed not sitting in a sterile room. A sterile room would mean the absence of anything living. And I don't know of any sterile room in nature, there is no such thing. Creating such a sterile room would be highly complex. I have also never been in a sterile room, I am always surrounded by microbes. They also say microbes are ubiquitous, they are always available everywhere. But they only work on the command of conflict resolution, which is called vagatonia, that phase when I get tired and limp and sick. Out of 100 patients who come to the doctor, 80 are in a healing phase. And the healing phase is also when the microbes are at work. In his time, Pasteur said that the microbe makes you sick. Man is healthy when he has no microbes, but sick when he has some. This idea is the foundation of conventional medicine, to this very day. That's a whopping 150 years. Like the church, there's no progress. Perhaps it is also because this is very lucrative, a business based on fear, because Pasteur's idea has long been disproved. However, even now, the conventional doctors argue unwaveringly on the side of Pasteur and say that the microbe causes the healing phase. This is like pointing out that when the garbage collector comes, it usually stinks. But would we do away with the garbage collector so that it would no longer stink? It's nonsense. We live in symbiosis with the old brain-controlled microbes, fungi and fungal bacteria or mycobacteria. Our brain has a code for each type of microbe. Yes, your brain turns them on when you need them in the healing phase, after resolving a conflict. And at the end of the healing, when you don't need them anymore, they're turned off again. The task of the fungi and fungal bacteria is to clear away tissues. And they can only clear away. Whereas the bacteria, they can do both. They can break down and build up tissues. In a splintered fracture, for example, there are bone splinters embedded in the tissue. On the one hand, the bacteria help to recalcify the injured bone tissue. But at the same time, they also clear away these bone splinters in the tissue. So bacteria can do both. Only viruses cannot do anything. Because they do not exist. As I mentioned before, the squamous epithelium tissue repaired under swelling, and without microbes. The old brain-controlled fungi and fungal bacteria, I need them already during the conflict, in the conflict active phase. These, under command from the brain, multiply in synchrony with the tumor itself. The prostate carcinoma gets bigger and bigger. Or the breast cancer, controlled by the cerebellum, the node becomes bigger and bigger. And synchronously, the fungal bacteria multiply at exactly the same rate. However, these microbes are not yet active, they do not work, and they do not yet have a metabolism. This is the phenomenon observed with dark field microscopy, in which you can tell, from the microbes in the blood, that there is cancer somewhere in the body. What's happening is, that nature already has conflict resolution in mind. In the yellow group, colorectal cancer, lung cancer, or in the yellow-orange striped group, breast cancer, skin cancer, and melanoma, nature is counting on us to resolve that conflict. For this reason, I don't have forever to resolve it. Here, the clock is ticking. I have to solve the conflict. Mother Nature is expecting that this conflict will be solved. With the resolution of the conflict, the cell division stops automatically. The tumor cells differ genetically from normal intestinal villus cells or mammary gland cells. That's how they're recognized by the microbes to be degraded tuberculously. If I don't have microbes, then this tumor remains, and that's not good. How come I don't have microbes? No antibiotic makes my microbes go away. Antibiotics actually have a sympathicotonic effect. In fact, antibiotics belong to the cytostatic group of drugs. Yes, that antibiotic is a little chemo drug. The patient now has cold hands, and he is lifted out of his vagatonic healing phase. The microbe automatically stops working, because the microbe works only in vagatonia, but in the next healing phase, they are already working again. And then I get the next load of antibiotics. So, once I have the microbe, I never lose it again. I can only prevent it from working, by taking sympathicotonic substances. By the way, substances act on the organ via the brain, never directly on the organ. The sympathetic nervous system or the vagus is activated via the brain. There are sympathicotonic substances like antibiotics, chemo, cortisone. And there are vagatonic substances like Valium. Antibiotics in particular typically act on the cerebral medulla, whereas cortisone typically acts on the cerebral cortex. This is why, for example, the neurodermatitis patient is not given an antibiotic, he is given cortisone. Neurodermatitis is controlled by the cerebral cortex. But for an abscess, you get antibiotics. Only vitamins, enzymes, and hormones act directly on the organ. But all other substances, including coffee, affect the organ via the brain. This is even the case for vaccination. Why does one vaccinate? To create and train antibodies, so to speak. Which are then to fight the evil microbes. Then, a large-scale attack comes, at least there are already a few soldiers present. This is how one imagines it. The only problem with this theory is, the body does not fight the microbes. It uses them. We need the microbes. We'll discuss vaccination a little bit more. You won't read much about it in Hummer's books, because it's just nonsense. I cannot vaccinate myself against any conflict. And the so-called carrier substances in vaccines are all neurotoxins. The vaccination process itself can be conflictive for a child. Plus, vaccinating does not prevent microbes. This is another common question from newcomers to GHK. Someone is vaccinated against tuberculosis, but that does not work. That cannot work at all. That's why they don't promise you vaccine protection like, you'll never have a tuberculosis now. That's absolute nonsense. It's the same with tetanus. What is tetanus? It is an epileptic seizure. If you get vaccinated against tetanus, it doesn't mean that you can never have an epileptic seizure again. It just doesn't work. Vaccinating is absolute nonsense. The only thing that prevents me from having a microbe is excessive hygiene. For example, if I've never been in contact with microbes. There was once an excellent television report about this. They broadcasted an excellent contribution about microbes, really super well done, with extensive 3D graphics. I was shown the program because I haven't had a TV for 30 years. In this program, they had rats growing up in an absolutely sterile room. The rats couldn't even walk. Their organs weren't correctly formed. And today, so many mothers run around and spray everything with disinfectant, and everything that the child wants to touch is disinfected first. And then, of course, it can happen that this child grows up without microbes, which is why these healing phases can't run optimally. They do run, but they are non-biological. The tumors remain, the holes remain. And of course, that's not the best thing in the world, it's unnatural. In nature, this would be impossible. If you are not certain whether you have necessary microbes or not, then do like a little child, have a big, wet and kiss with a pig. Then you'll for sure have all the microbes your body could ever need. To my seminar participants, I always offer my Emma, my Rottweiler lady. She is a really cuddly dog, and she certainly has all the microbes. You just need one lick across your face. My Emma is a certified Germanic therapy dog. It is also necessary to have had acquaintance with the microbes in childhood. Again, I need the fungi and the fungal bacteria already at the time of the conflict. Because I never know when I will have a conflict, it could be the next moment, or the next month, I should strive to have the microbes as collaborators in my body now. If you ever watch a toddler crawling around the yard unsupervised, the things that a child puts in his mouth, there's really everything in there. But as an adult, you don't do that anymore. And we should let the children do that too. Just like my granddaughter, she'll be 6 soon, but when she was 1 year old and just starting to walk, she was nuzzling on a piece of bread. She stuck the piece of bread deep down Emma's throat, pulled it out, and then continued to nuzzle on the bread. And my daughter, the child's mother, asked my wife, "Mom, what am I supposed to do?" Says my wife, "Don't look." Then you don't have to get upset. We do this only in childhood. As adults, we don't do it anymore. And in the process, we take in the microbes and our bodies get acquainted with the microbes. Now, we have no problem with the microbes present at our own latitudes. But what happens when I get on a plane and fly to Asia, for example? There are, of course, wholly different microbes. I go on vacation and think to myself, what do I care about my problems at home now? I unwind and get into healing. Only now, my body doesn't know how to deal with these microbes, so it can already come to an overreaction. By the way, the first healing is always more violent than the following ones. It's as if the body first has to adjust. And nature doesn't have a program for airplanes either, that lets us reach a destination thousands of miles away in a few hours. In nature I would have to walk there, and there I would be on the road for several months. If I have the flu in Greece, in Turkey, and then again somewhere else, my body will adjust, provided that I walk there. But nowadays, I easily get into an entirely different microbial environment. But of course, this only matters when I am in a healing phase. When I'm healthy, the microbes don't touch me at all. They don't even touch me when I am conflict active. The microbes do not work in the active phase, in sympathetic atonia, never. No microbe. There is also a famous example of Pasteur who, out of love sickness, wanted to kill himself, and so he swallowed a glass of microbe solution. Everyone thought, whoa. But nothing happened. He was in sympathetic atonia, he was heartbroken, so nothing could happen. Another way to get your microbes, just drink a glass of fresh, raw milk. By the way, it's also because of pasteurization that we don't have microbes anymore. The younger generations don't have those microbes anymore, because everything has been made sterile. So cow's milk, goat's milk, not boiled, not sterilized, that will give you the microbes. Or a mother can inoculate her child with microbes through breast milk. There are no microbes in baby formulas and foods either, even if they're organic. Such foods are not necessarily what the child needs, either. I need the bacteria in the healing phase to fill up the holes and necroses in the connective tissue. Here's a way to remember this. Fungi are found in damp and cold environments, but you can only grow bacteria in an incubator, which imitates Vegetonia. A famous example of how bacteria work with bones is at the dentist. So let's say my father beats up my mother, and I as a boy can't fight off my father. He's too powerful. Now, each of my teeth has a particular bite conflict. Being unable to fight off my father affects my teeth bones and my jaw bone. Tooth bone and jaw bone have the same conflict content, which is about inability to fight someone off. What do we do with the incisors? We snap, or we fend off. So, it's like a snarling dog. The canines, the fangs, are to make you stay here, to hold on. I need my molars to crush someone. There's a big difference between fighting someone off, holding them, and crushing them. So, if I can't fight off the father, it affects the front jawbone. Upper or lower, or both. I don't notice the jawbone osteolysis, it doesn't hurt. The teeth can become loose and fall out. So-called periodontal disease is conflict active, an active biting conflict. The bone becomes thinner and thinner. It then seems as if the necks of the teeth come out, so-called receding gums. But what's really happening is that the bone becomes thinner and thinner until the gums simply slip back. But then let's say I gather my courage and say, "Father, if you ever attack my mother again, I'll report you to the police." So now he keeps his hands off the mother and I get into the healing phase. I was able to fight him off and resolve the conflict, and my brain just turned on the bacteria that will help me recalcify my jawbone under swelling. What hurts with bone healing is the periosteum. That's typically what makes us go to the dentist. 80 patients out of 100 who consult a dentist are in the healing phase. The dentist looks in my mouth and scolds me because everything is full of bacteria, and I obviously don't brush my teeth. The dentist believes these healing symptoms are bad and that the bacteria are to blame. But really, he's finding the bacteria at work. It's like saying, I've seen 100 major fires now, and all 100 times the fire brigade has been in front of them. I know who sets major fires. It must be the fire brigade. Except that's not true. And what is Lyme disease? Fungi, bacteria, or viruses? It's bacteria. And what does the Lyme disease patient typically suffer from? Joint pain. If we cut through a joint, what tissue do we find? We have bone, cartilage, tendons, and muscles. So we are in the orange group with all these tissues. And pain always means healing. The active phase in a cartilage program, when the holes get bigger and bigger, doesn't hurt. The healing hurts, that's when the tissue is being repaired under swelling. And the healing is also where the bacteria work. They are responsible for that connective tissue. They belong there. What condition does the patient really have? He has a self-devaluation program in healing, or more likely, he's in hanging healing via tracts, activated again and again via a track, in out, in out. So, he is chronically ill and has chronic pain. Of course, there are also chronically bacteria at work. Every time he comes into healing. But the bacteria did not cause this, the cause was the self-devaluation conflict. Each joint also has its particular conflict content. Take the elbow. That's not being able to hit. Or the knee, sportiness. The hip, not being able to assert yourself. And so on. That's the cause. The bacteria are just the healing phase optimizers, the garbage men, if you will. And I need all these microbes as surgeons, in case tissue removal is necessary. As I've already said several times, the fungi and fungal bacteria only clear away tissue that is no longer needed. Only bacteria can both degrade and build up tissue, as needed. So what, in this context, is Clostridium tetani, the so-called tetanus bacterium? A bacterium in an epileptic seizure program? Now it gets a little bit complicated. We have a muscle cell. Muscle tissue is, of course, connective tissue. Think of a piece of steak. The cause of muscle atrophy, what we see in the tetanus or lockjaw program, is a motor conflict. Now we have, generally, two different brain relays for each of our muscle cells, and also for the myocardium. There's the brain relay in the cerebral medulla for the skeletal muscle, orange group. And there's the brain relay in the cerebral cortex in the motor system, red group. From the motor cortex comes the command to the muscle cell to contract or relax, in order to perform a movement. But if I suffer a motor conflict, then I have functional failure. This is the third group of special programs, which neither build up nor break down cells in the conflict active phase, but rather has a loss of function. In the case of an active motor conflict, we see flaccid paralysis of the muscle. Now my arm doesn't obey me. As a result of my muscle not doing what I want, I have another Hummer focus, this one in my cerebral medulla, which controls the connective tissue. The command that comes down to the muscle cell is necrosis, followed by cell buildup. In other words, I have a self-devaluation about the paralysis. The self-devaluation is because of the muscle atrophy. Muscle atrophy is always self-devaluation due to paralysis. Or, to put it another way, to resolve muscle atrophy, I have to resolve a motor conflict. If I can solve this motor conflict, then this Hummer focus in the motor cortex goes into solution, and the commands are coming through to the muscle cells again. Or, rather, half of them are. The muscle obeys again, and because my arm obeys again, I solve my self-devaluation conflict. However, this then switches the connective tissue over into the healing phase. And for this, my brain switches on the microbes. The crisis of the program in the motor cortex center follows, and since all crises are symptoms of the brain, it produces an epileptic seizure in the affected muscle tissue. A crisis of the cerebral medulla isn't noticeable. One is cold, that's all there is to it. It's the same with a crisis of a bone program, one only feels cold. And so it is also with a crisis of connective tissue and fat tissue. These are inconspicuous. One is cold. It's relatively unspectacular. But in the crisis of the motor cortex center, there I have the epileptic seizure. Every crisis is always a healing phase symptom that happens about halfway through the healing phase. In and of itself, the crisis is a reason for joy because it shows me that I can resolve a conflict. Now, if a dog bites into my calf and I can't get the mud away, that's a conflict. The two brain relays for muscle always run synchronously. At that moment I have paralysis and, at the same time, muscle atrophy. If I manage to get the mud off my calf, I solve the conflict and I get my epileptic seizure. If I look closely at the organ level, I'll see my bacteria at work. But these bacteria did not cause the healing phase that is going on now. The cause was the motor conflict with the mud. There was once a funny crime movie series in Austria, Koten Investigates. The police chief, who was a bit of an idiot, slammed his hand down on the table. Only he slammed it down on one of those receipt spikes and jammed it through the palm of his hand. That's the motor conflict, I can't get my hand away. As soon as I do get my hand away, that's the solution to the motor conflict, and then I convulse. But that has nothing to do with bacteria as a trigger, not at all. That the motor conflict. As I have already said several times, I cannot protect myself against conflicts, so how can a vaccination protect me against that? True tetanus vaccination would mean that I cannot be bitten by a dog again. But I can't vaccinate myself against dogs, that's not possible. I need all these microbes as surgeons, in case tissue removal is necessary. Again, the fungi and fungal bacteria only clear away tissue that is no longer needed. Only the bacteria can both degrade and build up tissue as needed. We always have tuberculous healing in the healing phase in glandular and gland-like tissue. That is in the old brain programs, provided we have the microbes. A typical symptom of such tuberculous healing is the night sweat, the sweaty nightgown symptom. If you have experienced this yourself, it's a double reason for joy. On the one hand it means you have the microbes, and once you've got the microbes, you'll always have the microbes, because you can't get rid of them, fortunately. Secondly, it means you've experienced the process of healing from a little prostate cancer carcinoma or breast cancer carcinoma. When you're having night sweats, you're on your way to spontaneous recovery. That's what the symptom of night sweats is telling you. Now think about it. How many times have you had night sweats? I know night sweats, and let me put it this way, I also know what soil tastes like, what sand tastes like, what rottenwood tastes like. I grew up in the countryside, which is fortunate because I really had a beautiful childhood. But the younger generations today don't even know this thing, because they grew up with excessive overhygiene. They were never allowed to romp around in the mud, and they weren't even allowed to put a horse apple in their mouths. Kids don't know things like that anymore, and that's not so good. We, of course, have our sweaty nightgown in the deepest vagatonia. And when do we have the deepest vagatonia in a healing phase? Always towards the morning. By the way, this is a simplified graph. We have to imagine the day-night rhythm on top of this as well. During the day, I am less deeply in vagatonia than I am at night. And when do I reach the deepest point of vagatonia? At 4 a.m. When I am in such a vagatonic healing phase for several days, I have the deepest point of my healing phase at around 4 a.m. The temperature is often only minimally elevated. Maybe only by half a degree. So, I don't have a fever when I have night sweats, but everything is really wet, and that's always a cause for rejoicing. When my daughter Olivia had her liver cancer back then, Mommy stayed with her and cooked for her. During that time, we had to change her pajamas twice a night. They were soaking wet. A 5-year-old child, soaking wet. That is an unmistakable sign of such a healing phase, a reason for joy. But with conventional medicine, you run to the conventional doctor and tell him, "Doctor, I have night sweats. Make that go away." Then you are under suspicion of cancer. That is similar to suspicion of terrorism, so you are already sucked into the machine. They are not stupid, the conventional doctors. They know how to catch their fish. Now, with any tuberculosis, the body loses protein. For example, with the intestine in the healing phase, excuse the choice of words, but then you literally shit protein. Foam is pure protein. The body immediately retrieves the lost protein from the muscles. This causes a patient to lose weight down to the skin and bones. This loss of protein must be compensated for. Fortunately, the patient usually also has a good appetite and devours everything in his vicinity. And that's a good thing, because the healing phase will wear him out if he doesn't do that. So, I can be consumed in the active phase because I don't eat, and I don't sleep. I mobilized all my strength, and at some point my battery is drained. Let's say you lock a cat in a room with a Rottweiler. The cat runs in circles for a few hours, but then it's dead. But I can also become emaciated in a vagatonic healing phase, because of this protein loss. You have to compensate for that through diet. I may have to really supplement protein specifically. Astronaut food or some such thing. This can be seen clearly in the many cases of pulmonary tuberculosis around 1900. At that time, pulmonary tuberculosis was also known as consumption. One literally melted away. At that time it was also called poor people disease, because rich people with tuberculosis were brought out into the open air, fed a protein-rich diet, and they all survived. Poor people had to fight for their daily bread, with no energy to spare. Poor people who could only afford meat or plenty of eggs maybe once a month died of pulmonary tuberculosis, like flies. And then there is this form of therapy of trying to starve cancer. That is evil personified, superstition on steroids. One imagines cancer as an alien being in one's own body, that wants to eat me alive. If I don't eat, then this alien being must starve. Such is this concept. Attention, this is suicide. The idea of starving cancer, that's nonsense on steroids. It is your own body that is doing this special program, nobody else. Every mother is happy when her sick child eats. No mother would refuse her sick child food when the child is hungry. We adults, we really can be so stupid. And I have seen so many who wanted to starve their cancer in real life, and that was it. But that's their fault. Even some who have been to one of my lectures. So with some people, it goes in one ear and out the other, they don't retain anything. I haven't found a pattern yet. Due to the loss of protein in a tuberculous healing phase, one also has a ravenous appetite, and one eats endlessly. For example, Dr. Hummer always had boxer dogs. One day, someone poisoned the alpha dog. The alpha had constantly reprimanded his son by nipping him on the neck. When the alpha was dead, the son came into the healing from this, apparently, with a tuberculosis on his neck. He basically had the bubonic plague. Melanomas that burst open and created serious holes. It stank nauseatingly, and this dog just lay flat, exhausted. That is also typical for tuberculous healing, you really feel like you are 80. You drag yourself to bed on all fours, and you're just sleeping all the time. You are miserable and tired. This dog would only either lie down, or move to feed. He ate double portions, then immediately slept again. Eating double and sleeping again, that's part of it, that's normal, and that's good. Better 2 steaks than only half. And every tuberculosis stinks. The air that a pulmonary tuberculosis patient exhales stinks of rotten flesh, as if he were decomposing. By the way, if you are lucky enough to sit across from a person with pulmonary tuberculosis, ask him to cough on you and breathe deeply so that you will have the microbes if you ever need them. This goes against every hygiene rule, I know. The microbe doesn't do anything, but I need it. The problem is not so much the symptom, but the original conflict that initiates the program. Of course, in a tuberculous healing phase we also have to behave wisely. For example, if I get a lung round tumor, it will be cleared with tuberculous mycobacteria in the healing phase. Every tuberculous healing on the organ starts in the middle of the tumor. Breast cancer, too, is always cleared from its center in a necrotizing and secreting way. The wall of the tumor towards the outside becomes thinner and thinner. If I am in such tuberculous healing with a pulmonary nodule and think to myself, today it's such nice weather. I'll get the bicycle out of the cellar, and I have to make an effort, the tissue can tear and my lung can collapse. Every freshly diagnosed patient who has no idea about therapy or Germanische Heilkunde should at least be made to understand not to do such stupidity. And of course, he must not fast, that is dangerous. Just stay in bed and take care of yourself. Unfortunately, you can't teach people that in a hurry. And certainly not when thousands of miles are between us and the telephone is constantly ringing. We need sanatoriums where every cleaner knows what's going on and where the patient isn't panicked, where they take care of him so that he doesn't do anything stupid. He is fed protein-rich food, and can take it easy until the pulmonary focus is finally cleared away. But we do not have all that. We are not allowed all that. Also remember that in this program, there's a piece of tissue missing. With anything that is glandular or gland-like tissue, a certain amount of the original tissue is missing after a healing phase. If I get into a hanging healing with a program like this, the original tissue melts away. In the prostate, this can also lead to the drying up of the seminal fluid, leaving the patient with no more ejaculate. Or in the breast, it can lead to sagging breasts. In the lungs, it can lead to sarcoidosis of the lungs. In the thyroid, hypothyroidism. It is and remains an emergency program, which, of course, also costs us something. But usually our organs are oversized, so now we don't have 100% lung capacity. We have 98% lung capacity. But at the end of the healing process, a piece is missing, and the cavity is then scarred with connective tissue and reinforced with calcium. Calcification, by the way, is also always a residual condition of tuberculous healing. Calcified foci in the lungs then remain for life, but they are harmless. That is the end of a healing that is done and completed. But in the X-ray, you can perfectly see these foci of calcium. In the breast, the calcium is considered evil. That's nonsense. It marks the end of a healing, or it can also be a hanging healing. Under certain circumstances, it can be the entire prostate become calcified. Or the calcium focus in the liver. In Olivia's case, you can still see Lyme foci in her liver, because she had liver cancer as a young child. By the way, this is a sublingual salivary gland stone. This case is a great example. The sublingual salivary gland on the right means there's been a conflict of, I can't get hold of a morsel. In the active phase, we see cell growth. This makes more mucus available to be able to swallow the morsel after all. Once this is done and the conflict is solved, the cell division stops, and I enter the healing phase. Now the previously formed tissue is tuberculously degraded and in the end, some Lyme, calcification, remains. But if a real stone forms here, it means this program has been activated repeatedly via tracks, a hanging healing. This creates more and more Lyme, calcification, and Lyme with each run of the program. In this example, the tumor under the tongue was as big as a walnut. When they encounter such a patient in conventional medicine, they cut away all the healthy tissue. I have experienced several times an affected person who was missing a large piece of tissue, and then the remaining tissue was irradiated and completely destroyed. Such patients do not survive this kind of therapy for long. In this example, it was a woman who had this conflict, and this is actually unbelievable. The morsel was garden paver stones, which her husband did not want to lay for her. That was her conflict. Because of something so banal, the system destroys people. But then she got her way and her husband laid the paver stones for her. This was the immediate solution, and she came into healing. In the healing process, the tumor that had previously built up was tuberculously degraded under swelling. Since this was all taking place in the yellow tissue group, endoderm, it was tense, and of course it hurt a lot. It got to the point that she wanted to lance herself. She opened her mouth and suddenly it went clonk. And a 2-centimeter stone fell into the sink. To this day, this woman has retained nothing of that tumor or the calcification, nothing at all, as if she never had it. And that is real healing. To destroy patients over of something like this, to irradiate them with some 100 million expensive radiation cannons, that's all hocus pocus. They earn a Golden Nose Award for this, while the patient remains in the dark. And all of this is scientifically recognized. Disgusting. After healing, nothing remains but a cavern, that is a scarred cavity. In the lung the cavern remains open, because we inflate the lung with air when we breathe. In the breast, the cavern encapsulates. As discussed before, on a mammogram you can't often see the cavern. Instead, you see the calcium residue in the cavern, because the cavern is connective tissue that's been strengthened with calcium. You can see the calcium in the X-ray, and, of course, it is considered to be evil. What a load of rubbish. Here's another example from Hummer's boxer dogs. Once, brother and sister mated, incest. But of course, no alpha wolf would tolerate that. In this pack, the alpha was the mother of the two that created offspring. This grandmother dog wanted to bite the pups to death, and a fight developed between daughter and mother dog. Both suffered a conflict. The grandmother dog lost, because she was too old and she died of emaciation, conflict active. The daughter dog, mother of the pups, suffered carcinoma of the teats. When the grandmother dog was dead, that was the solution for the daughter dog, and her tumor was tuberculously removed. After that, when the boxer puppies suckled, they had such thick teats to deal with. One teat hung a few centimeters lower than the others, on a triangle of skin. You could really feel the cavern. If you moved the skin back and forth, you could feel the cavern very clearly. This is a real healing, without side effects. Also, don't forget that in conventional medicine, the few who survive it are sterile afterward. They can't have children anymore. The patient, however, who spontaneously becomes healthy, why should she not have children anymore? Of course, this woman still can have children because that is a real healing. Everything else is just a business model, infinitely cruel but very lucrative. It is hard to understand why people let themselves be screwed so much. This can also happen when we get into hanging healing with a program in the glandular tissue. As I said, at the end of the healing, a piece of the original tissue is missing. If I run through such a program only once, I'll still have 98% or 95% of my original tissue. I can live perfectly well with that. But if I go through this program hundreds or thousands of times, then the original tissue melts away, leading to hypothyroidism, cystic fibrosis, sagging breasts, shrunken kidneys, or drying up of prostatic fluid. Hypothyroidism is an example of this. The thyroid gland belongs to the yellow group. For the lobe of the thyroid on the right side, the conflict is, I am too slow to catch the morsel. For the left thyroid lobe, I was too slow to get rid of the morsel. In the active phase of either of these conflicts, the thyroid increases its tissue, cell plus, and releases more hormones, which is also the biological sense of this program. As a result of the hyperthyroidism that I'm now in, I get faster in real terms. A patient with hyperthyroidism manages to work through 3 weeks without sleeping, which is the biological sense of the program. The conflict was, I was too slow, therefore, I am getting faster. The special programs are precisely targeted. They always help me solve the cause. Hypothyroidism is a hanging healing of this program. It melts away the original tissue. Thus, hypothyroidism has the same cause as hyperthyroidism, only hypothyroidism is the hanging healing of it. Attention, once the tissue is gone, it remains gone. No new tissue will grow there. The problem here is, that we not avoid the track. Every animal avoids the track. An animal notices the recurrence of the stress. Meanwhile, we humans are stressed from early morning until late in the evening, running like hamsters on a hamster wheel. We do not avoid the track. Once the tissue has melted away, you need to substitute hormones to be able to function at all. As Dr. Hummer put it, you swallow your substitute hormones. Otherwise, you won't make it. You won't get on your feet, and you will be utterly listless with thyroid underfunction. This is also an example in which Dr. Hummer recommends medication. Hypothyroidism was exemplified in real time at a Hummer seminar in Spain. A 57-year-old woman had hypothyroidism. She had hardly any thyroid tissue left, and her conflict was, when she was 16. On top of that, she was a nympho. There is the nymphomaniac, and there is also the nymphodepressive. We discussed that in great detail in the Constellations and Psychoses training. This woman, when she was 16, went on vacation with her aunt at the seaside. There in the aunt's house, the neighbor boy went in and out, a young farmer. He showed interest in the girl, and she soon began to see herself as a farmer's wife on the farmer's farm. But nymphos have admirers everywhere. One day, one of these admirers sent her a love letter which she left open on her aunt's kitchen table, where it was seen by the young farmer when he next came in. At age 16 she suffered a conflict in the left lobe of her thyroid, a conflict that she was too slow to get rid of the love letter, which effectively made her too slow to get the young farmer. Once he'd seen the love letter from a different admirer, He no longer showed interest in the girl, which put her into thyroid hyperfunction. This 16-year-old nympho came to Dr. Hummer's seminar as a 57-year-old nympho. Some people just never change. To that day, she still regularly visited her aunt at the seaside. To that day, she still squinted over at the farmer's farm and put herself briefly on the track, every time. The rest was the hanging healing. And she hardly had any thyroid tissue left. Cystic fibrosis of the goblet cells in the bronchi is a similar program, also the yellow group. The bronchi have to be kept moist, and the mucus to do this is secreted by the goblet cells. The conflict affecting the goblet cells is fear of suffocation. A typical case of this conflict is the newborn with the umbilical cord around the neck. At the moment of the conflict, these goblet cells begin to proliferate in order to create more mucus, so that this morsel of air slides better through the airway, thereby getting you better airflow and so making it easier for you to solve the conflict. At the end of the healing process, however, some portion of the original collection of goblet cells is missing. Which means a bit less mucus providing lubrication in the bronchi, and so I feel I'm getting less air again. That means that I can have a recurrence of the fear of suffocation conflict, and start the same program again. If I get into hanging healing with this program, then the original tissue melts away. So, I get less and less air, and therefore I have more and more recurrences of the conflict. This cystic fibrosis is something quite horrible. These patients suffocate very slowly. They must always have optimal air quality so that they never feel they are in respiratory distress. Once a grandmother called me about her granddaughter who had cystic fibrosis. The child was born with her umbilical cord around her neck. This woman's daughter-in-law, the child's mother, was a doctor, MD. She would put a blanket over the child's nose, to prevent her from catching a cold. That is precisely the wrong thing to do. This child must always be able to breathe freely. Sagging breasts are always a worry conflict. When the parents quarrel, a daughter sits in the middle, worrying about mom, worrying about dad. Please reconcile. They do reconcile, but the next month the shreds fly again. And the daughter is again on the track and has a recurrence again with the glands of both breasts. Then the parents reconcile again. In out, in out. And suddenly the daughter has no more glandular tissue in her breasts. They hang down like limp sacks. The tissue doesn't regrow, either. The same thing can happen with the prostate. At what age should men typically start prostate screening? That sounds so nice and confidence-inspiring, doesn't it? The screening. But you're trapped there. If they find anything, then you're in the mill from 50 onward. Meanwhile, at about 50 the woman comes into her hormonal change, becomes masculine as a result and her libido drops. The man has desire, she waves it off. And of course, that's the typical prostate conflict. Then she gives him a one-off rendezvous, which is the solution for him. But then they sleep in separate beds again. In out, in out. It's not long before he has no prostate tissue left, the prostate is entirely calcified, and then he's all dried up. When he walks, the calcium rattles. The poor man has no more prostatic fluid, his ejaculate is pure sperm droplets, because ejaculate is 2% as semen and 98% prostate secretion. This man, after hanging healing with the prostate program, ejaculates only droplets of semen. Dr. Hummer said, "This is typical for the Casanova who holds back because he is married. There are always pretty women dancing under his nose, but he holds it back. Then he can get into hanging healing and have problems with his prostate. The organ calcifies, and he has no more ejaculate." Another example is the shrinking kidney. That is the existence conflict in hanging healing. The kidney collecting tubules melt away. It's exactly the other way around with the connective tissue. Connective tissue is thicker at the end of the healing than before, which is also the biological sense with all tissues of the deluxe group. If I have an active self-devaluation conflict that I cannot solve, then my tendon necrotizes and shifts, or I break my bone and then I am prey. Here, nature doesn't help me right away in the active phase, but only when I solve the self-devaluation conflict. The tendon is repaired with swelling and with the help of the bacteria. So is the bone. At the end of the healing, the swelling goes down. However, the tendon remains thicker and denser than it was before. So does the bone. Just like after a bone fracture, the bone remains denser and thicker for a lifetime. This is precisely the biological sense of this program, which appears only at the end of healing, but immediately and for the rest of your life. But it is not useful to let yourself get on the track. Because then you get into hanging healing, and then the tissue gets thicker, thicker, and thicker. We see this, for example, as a ganglion cyst on the wrist. The wrist has the conflict content of not being able to handle a situation. Not being able to handle the partner's cheating or not being able to handle the son's drug addiction. This then becomes the ganglion, which becomes thicker and thicker. We can also see a tendon ossify, a heel spur for example, or a calcified shoulder. The calcified shoulder means I would like to hug my son, but I can't because I have real anger towards him. Or I feel like a bad father because I can't give him my love. I can't hug him, and the tendon that makes that movement is affected. Should I get into a hanging healing with that conflict, the tendon literally calcifies. Even cellulite is an example of hanging healing in the luxury group of tissues. The mildest self-devaluation conflicts go to the fatty tissue. If a man tells a woman, "You have an ass like your mother," and the woman suffers a self-devaluation conflict with this, then her fatty tissue necrotizes, thus solving the self-devaluation conflict because now her ass is thinner. However, in healing, the fatty tissue is repaired under swelling, and at the end of healing, it remains thicker than it was before, which again is the biological sense. In nature, fat is considered pretty and healthy. Skinny is considered sick and ugly in nature. A buck jumps on the big, fat doe. He leaves the skinny, rickety one alone. In nature, becoming lean is not an art. To be fat is the art that all in nature respect. So now, after she's solved the self-devaluation, she is fatter than before. She sees herself in the mirror and hears her husband's comment in the back of her mind. Now she is effectively allergic to the reflection of her figure, the conflict recurs, and now her fat tissue is necrotizing again. Later, she is out in the garden with her flowers, and she forgets about her figure. This gets her even fatter. And the more out of shape she feels, the more often she has her self-devaluations and the more out of shape she gets. Why? Because we think wrong. Wrong ideas have been implanted in our heads. Induced lunacy. We run on remote control in whatever direction someone would like to take us. The ideal figure is the Barbie doll, and of course there are the starvation diets, and then we create fashion based on all this and who knows what else. The result is that people are eternally unhappy and try to make themselves happy again through various promises of consumer goods. It's the same in religion. It's undesirable that you would actually understand your religion, because then the priest would be superfluous. We have religion so that, for example, we can be like Jesus, free from sin. Only that's impossible. And that is exactly as intended. You should always have a bad conscience, because then of course you can be steered, controlled and manipulated, and the religion's leaders can earn money on you. This is all possible because they implant nothing but nonsense into our heads. It's precisely the same with a keloid scar. Let's say you've had thyroid surgery. Now you have a scar that you have to look at in the mirror, and the scar naturally bothers you. That annoyance is a mild self-devaluation conflict, and now the scar necrotizes and becomes thinner and thinner. That resolves the conflict for you, and you come into the healing phase. And at the end of the healing the keloid is thicker than before. So now you get into hanging healing, and now the scar tissue becomes thicker, thicker, and thicker. According to the fifth biological law of nature, there can be no contagion, because the microbe does nothing by itself. Despite constantly having them around me, on me and in me, microbes activate and obey only on command. That command is called conflict resolution. So only in the vagatonic healing phase do the microbes work, otherwise they do not. If this is true, then there can be no contagion. But more than one of us may very well have the same problem at the same time. Then we also have the same special programs running at the same time. And we can also solve the problem at the same time, and then we'll have the same healing phase symptoms. That is entirely possible. You can see this very well in tuberculosis cases. The curves from Germany and Austria are congruent. Germany has 10 times more people than Austria, but the curve is exactly the same. Around 1900, there were thousands of cases of tuberculosis. Today, this number is down to a few hundred. Especially around the time of the war, tuberculosis appears to spread epidemically. But what is tuberculosis? Tuberculosis is from the yellow group, the morsel conflicts. Around 1900, there was bitter need. The suburbs of Vienna were slums. Back then you had to fight for your daily bread. Today there is prosperity. We have breakfast, lunch and dinner. That's not even a topic of discussion today. That's taken for granted. Today, we don't have the conflicts of our grandparents or great-grandparents. And always at wartime, the need was even greater. Then, after every war, the pulmonary tuberculosis cases increased in number. Of course, during the war, many people simultaneously had death frights. When peace was then declared, or when men came safely home from the front on leave, then many would simultaneously solve their death fright. So many people had pulmonary tuberculosis at the same time. But this had nothing to do with contagion. By the way, Switzerland does not have these spikes upwards in the tuberculosis case numbers. Switzerland was never at war. In Switzerland the curve went down smoothly. When conventional medicine wants to pat itself on the back, it always brings up penicillin, which was around from 1948. So, they always just point to the curve here, how it continuously drops after the war. But the curve from before the war, they don't show you that. The decline in tuberculosis cases has nothing to do with penicillin. The common denominator here is prosperity. The poverty and the prosperity. These death fright conflicts used to be more frequent than they are today. As discussed before, always look for the common denominator. There are people who always get sick when they first begin a vacation. You can tick off what they have. Their company is a track to their conflict, and when they go on vacation, they get off the track and consequently get sick. All it takes is that vacation time or holiday season begins, and a lot of people come off the track at the same time. This is then sold to us as the summer flu. Also, we have regional or global events that affect many people equally. Let's say we get 10 inches of snow. It stinks to me, I have to drive several hundred miles. It stinks to you too, you think about shoveling snow. But my son is looking forward to skiing, he doesn't mind. Now I'm the first to get my job done. I come inside, sit down and solve my stink conflict. And I start to sneeze. You come in 15 minutes later from shoveling snow. You also solve your conflict, and 15 minutes after me, you sneeze too. So you claim that I have infected you. But my son doesn't sneeze at all, so we simply say that he has a better immune system. The other day, a kindergarten was closed because of chickenpox. Chickenpox is the healing of a separation conflict. Siegfried Mohr is a Hummer therapist from Cologne. He took up the case and found that out of 4 groups, only 1 group was affected. Furthermore, although several children in that 1 group were affected, not all were. From the other 3 groups, not a single child was affected. It turned out that the kindergarten end of the affected group had been gone for a week, and a replacement teacher stepped in. That was the separation conflict for the children. When the usual kindergarten teacher returned, that was the solution for all those children who had each had a conflict about missing her. They then got chickenpox. Diarrhea with vomiting is the healing phase of the small intestine program, the upper and lower small intestine. The conflict is indigestible anger, with a starvation aspect. They took the butter off my bread. That annoys me. I have less than I am supposed to have. And when I solve this conflict, I have diarrhea and vomiting. From Austria I organized a seminar room for my seminar in Germany. That seminar room cost money. Less than an hour before I had to leave to travel to Germany for the seminar, they called to let me know it worked out with the seminar, only now, without warning, the price was increased by a considerable amount. I hate when people do that after agreeing to terms, whether the contract they've committed to was verbal or written. For me it's the word, the handshake, and the agreement is made. I had to go, so I turned this matter over to my wife to take care of. She was on the phone all the way to the tax office. Then they acknowledged it was their misunderstanding. The landlady for the seminar room had quoted me the net amount, but mistakenly charged me the gross amount. I could get the difference back from the tax office. But I thought she was trying to deceive me. I was already in Munich by the time my wife informed me of the mistake. The next morning I woke up and noticed a rumbling in my stomach, a feeling of nausea. I wondered if I would be able to make it to the bathroom in time. My next thought after waking up and experiencing these symptoms was, Helmut, what did you eat in Munich yesterday? I still remember to this day, it was turkey strip salad. Just thinking about it that next morning made me sick to my stomach. My third thought, still half asleep, was, Helmut, there was a new waiter in Munich, maybe he poisoned you. But once I was really awake, I thought consciously about it. Vomiting and diarrhea. I have a healing phase from an indigestible anger conflict with a starvation aspect. And with that, I realized it was the stupid issue with the price of the seminar room. She's taking the butter off my bread. At 10 a.m. the spook was already over. There were only very few hours of conflict load to be removed. I always talked to my wife on the phone at 10 a.m., shortly before the seminar was to begin. That morning my wife told me, miserable. I've got vomiting and diarrhea. And she blamed it on the lima beans. There had to have been a bad bean, because nobody else in the family had vomiting and diarrhea, so it must have been a single bad lima bean. Of course, it wasn't the turkey strip salad or the lima bean, it was the common denominator, the conflict that we experienced together. It was just the stupid seminar room. And my wife had been just as annoyed as I was. People wanted to take the butter off our bread. That was the common denominator. Pasteur created a massive problem for conventional medicine. He postulated that man is healthy when he has no microbes, and is sick when he has some. With this, he really triggered a worldwide microbe phobia at that time. This phobia even got to Nikola Tesla. Exactly this Tesla, the famous Nikola Tesla. Tesla would thereafter only shake hands with anyone if he was wearing gloves. Pasteur is still used to cause panic, fear the invisible evil. Today every child knows that our digestive systems would not function without microbes. We get our probiotic yogurt drink at the supermarket for $1.25, every child knows the advertising. And it's also now common knowledge that we have trillions of microbes inside us. We have 3 to 4 pounds of microbes in us and on us, and yet we are not sick. Trillions. Pasteur has long been disproven. Now remember, the microbes always work according to their specific tissue and germ layer. So, which are the microbes that work in the ectoderm? None at all. Because the viruses do not exist, and I always have the bacteria, but never fungi with the connective tissue. Skin consists of an outer skin layer and a subcutaneous layer, the dermis. The outer layer of the skin is where warts form, and warts are said to be caused by a virus. That's why it's also believed that warts are contagious. But viruses do not exist. In the dermis, the subcutaneous skin layer, is where the mycobacteria are at work. In the healing process, this tissue is broken down tuberculously, and it stinks. If you have a skin symptom and don't know whether it's the outer skin or the dermis, smell it. If it stinks, it's subcutaneous. Athlete's foot, for example, or a melanoma that's clearing. Okay, we'd come to the topic of Pasteur and thus the immune system. Conventional medicine claims that the immune system can deal with 1,000 cancer cells a day. It can recognize these and eliminate them. But at 1,001 cancer cells, we need chemotherapy. But now, with Dr. Hummer's work we see, wait a minute. None of this can get past the brain. You can't grow cancer without a brain, except for connective tissue, which you can keep dividing in a nutrient solution. That's how you grow tumors as big as rooms. But you can't breed colon cancer, you can't breed lung cancer, you can't breed breast cancer, you can't breed bone cancer. You can't breed anything if the nerve connections to the brain are cut. In a laboratory animal, a conflict is always set. Such animal experiments are cruel torture, but without the brain, there is no cancer. And even these connective tissue cultures, these tumors grown in nutrient solution, what are they really doing? They're keeping a healing phase going. In the active phase of a conflict, the connective tissue is necrotizing. At the end of the healing it's thicker than before. This type of tissue, according to Dr. Hummer, has an embryonic type growth spurt, and with added nutrients you can make it divide more and more. But otherwise, you can't grow cancer without a brain. The microbe is also switched on and off via your brain. Pasteur confessed on his deathbed, the microbe is nothing, the milieu is everything. You create the milieu yourself, by resolving the conflict. If you solve a conflict right now, for example, an hour later you'll have boiling hot hands. So you change the environment, the milieu, yourself. You always have the microbe on you, in you and around you. But it will work only on our command. This is what Pasteur corrected on his deathbed. But by the time he was on his deathbed, the microbe phobia was already kicking in. Pasteur instructed that his last descendant was to publish his journals. His last descendant did so about 25 years ago. He handed over Pasteur's journal to an American university, that then took 20 years to find out that Pasteur had committed scientific fraud. Pasteur had a guilty conscience. After all, he became world famous with his frauds. He tricked out his results, bent them the way he needed them. But the system jumped on this bandwagon and is still on this track today. Pasteur has long been disproved. We read about it 5 years ago in the Süddeutsche Zeitung, South Germany newspaper. In a way, conventional medicine is zombified, reanimated. Without reanimation, Pasteur's debunked germ theory would have been yesterday's news a long time ago. As for this famous immune system, you know from anatomy lessons what the lungs look like, what the intestines look like, what the heart looks like, or the brain. What does your immune system look like? Let me introduce it to you. This is what your immune system looks like. This is from an alternative practitioner's handbook, Infection and Defense. The guys look a little grim, but they're supposed to be the good guys. But if these fierce guys ever turn on you, then you have an autoimmune disease. Then you have the enemy inside you. An autoimmune disease is something like hypothyroidism. That's an autoimmune disease. Or diabetes, or MS. Those are autoimmune diseases according to conventional medicine. With Hummer's work we now see that if we resolve the conflicts in diabetes or MS, then the symptom disappears. Now, how does that relate to an immune system? Or an autoimmune disease? Think for a moment how many so-called immune boosters you can buy on the free market. This is a pious self-deception. You can eat royal jelly by the pound, but if you have your conflict, no royal jelly will protect you. I don't want to deny a healthy diet. But can eating cereals protect you from conflict? It's the same with vaccination, trying to stimulate something that does not exist. That's also bullshit. It's kind of like holy water that's supposed to protect you from the devil. Do you know why an elephant has red eyes? So he can better hide in the cherry tree. Yes, you laugh. But have you ever seen an elephant in a cherry tree? No? That's because he has red eyes. Of course, this is all nonsense, and especially so with vaccination. A mother hands her child over to the doctor. She practically abandons the child. The doctor ties the child down and pecks him. At this moment, the child suffers a motor conflict of not being able to fight off the doctor, with the track white coat. The child suffers paralysis. At home, the child resolves the motor conflict and has a seizure. The parents respond, "Oh my God. We'd better go back to the white coat." And so, it becomes perfectly chronic. The vaccination process itself can be conflictive, with or without serum in the needle. But then there are these highly toxic carrier substances, formaldehyde, mercury, aluminum. These are all neurotoxins. Vaccinating is not an issue at all in Germanische Heilkunde. I cannot vaccinate myself against conflicts. So why does someone really vaccinate? To strengthen their immune system. An immune system that doesn't even exist, but is supposed to be fighting the very microbes that are actually our symbionts. The whole concept is so endlessly nonsensical. Think for a moment about measles. With the whole measles story, how many parents have had their children taken away because they didn't want to vaccinate against measles? This is a compulsory vaccination in Germany and Italy, I think in France still, and I don't know where else. There, the police take the children away to vaccinate against something that has never been seen, the existence for which there is no proof. All pure fantasy, superstition, and tyranny. That's how you can sum it up. What were our children actually vaccinated against? What has the whole thing achieved, except negative consequences, lucrative business at the expense of our children? You must see through this yourself. This is not a misunderstanding on their part. No. There is a common thread, and you have to see through it. Their protection is in the fact that you can't think at that evil level the way they do. If you tell a lie is big enough, no one can believe it's a lie. That's what the deep state can best hide behind, like September 11th. Have you ever experienced this? A mosquito sits on you and before it can suck, you go splat and you have a bloody spot. Since it didn't have a chance to take the blood from you. Who did this blood come from? Shouldn't mosquitoes be able to transmit blood-borne viruses, for example HIV? From whom did that blood come? Do you know? Fortunately, it's all just nonsense. But they should transmit HIV. No, it's all just pure nonsense. Dr. Hummer said that these insects, fleas, mosquitoes, lice, ticks, have the task of spreading the microbe. A mosquito can tell that you are missing a microbe, or that you have a particularly tasty microbe. This is why some people are predestined for mosquito bites. If someone is bitten, it is always him, but no one else. Her partner is never stung, but she always is. Or if a child has lice, why always only this child? If a dog has ticks, why not the other dogs around him? Dr. Hummer said that the reason lies with the microbes. They are missing some, or they have some special microbes. I once observed this myself. Mother and daughter, two Polish women, both light blonde, flew to see Hummer in Spain. The two of them live in Spain even today, but at that time they had not 5 square centimeters of exposed skin that was without a mosquito bite. However, after 14 days the scare was over. They'd obviously been missing some microbes. As a result, they were mercilessly bitten by mosquitoes, and they suffered like dogs. But 14 days later, the scare was suddenly over. This is perhaps the perfect place to fit in the topic of the parasite. Parasites only come when the body calls them. If you eat meat, you also ingest countless worm eggs through the meat. But if the environment doesn't fit, they leave just as quickly. But if, for example, I am in hanging healing with an intestinal program, it makes cell growth in the conflict active phase, and in the healing, this extra tissue is tuberculously degraded again. I then have blood in the intestine, I have shreds of the intestinal mucosa, I have tumor chunks, I have dead tissue. For a worm-like creature, that of course is a land of milk and honey, and it thrives. Now I can go into worm with poison. I make myself sympathicotonic with poison, and thus the healing phase stops. But once the effect of the poison wears off, I come back into the healing, and already I have the parasite again. A better option is that I resolve my conflict. With that, I am healthy again and have my normal day-night rhythm back. Then the environment, the milieu, is no longer suitable for the parasite. It's the same with malaria, which also is a parasite. Attention, this is not a microbe, this is a parasite that stimulates blood production. If I'm in a vagatonic healing phase with a bone program, I also have leukemia, which is the milieu for malaria. Of course, people who live in malaria areas also have recurrent self-devaluation conflicts, but they know how to deal with the parasite. They are used to it from childhood. I myself have no problems with the microbes where I am. And if I fly as a healthy European into a malaria area, I don't get malaria. But if I fly there with chronic back pain, then I have optimal chances to get malaria, which can then, of course, be a really violent case of malaria. A lawyer who is a Hummer fan calls me. She had breast cancer years ago because of her son. The solution was that her son was able to give her a grandchild. This woman was fully healed. But then her daughter-in-law dealt her a death blow. Because she was a Hummer fan, her daughter-in-law withheld her grandchild. That broke her. But when she was fully healed again, she called me and said, "Helmut, you can't imagine. I have maggots on my breast cancer. They were there overnight, slurping and smacking, and within a day they were thick and fat and round as a ball. And then they just fell off. They were gone just as quickly as they came." However, she had not panicked at all. First she knew from Dr. Hummer that the parasites are the excavators, they come to clear away the gross garbage. Then the microbes come in and do the fine detail work. Even in the highly official conventional medical clinic in her city, they put maggot plasters on wounds that don't seem to want to heal. They're using this principle. They actually breed maggots for this very purpose. But they don't use housefly maggots. They use gold fly maggots. This sounds more valuable, but it's just the average turd fly. Before they are applied to the patient, the larvae are first coiffed, teeth brushed and butt wiped, in other words, they are disinfected. This prepared maggot plaster costs about €100, but when you're done, you throw it in the trash. But nature does all that on its own. The conventional doctor always tries to get a foot between the patient and his health. What else is he supposed to live on? Of course, because this is all pretty disgusting, it's easy to suffer consequential conflicts. Cancer sniffer, with 90% hit rate. That's a specially trained dog. He sniffs at all ends. In front and behind, and above and below. But what does he sniff? Tuberculosis in the healing phase is what the dog sniffs. Read and be amazed, bacteria eat tumors, tumors shrink within a short time. Or here, spontaneous healing of cancer by bacteria and fever. Hummer formulated the fourth law in the mid-80s. And they act like they are reinventing the wheel. The first two laws of nature are widely accepted. The third one, they are almost certain that it is also true too. At the University of Leipzig, a professor operates according to the germ layers, as formulated by Dr. Hummer, and he has fantastic success. He does not cut far into the healthy tissue, but operates along the tissue boundaries. And we've told you about the fourth law. The fifth biological law of nature, in conventional medicine presents of course an enormous problem. They already have a massive problem with the fourth law, the idea that the microbe isn't evil. Conventional medicine has a real problem with that. But the fifth law says, that there is nothing good and nothing evil. You can't take that belief in good and evil away from them, that is their way of thinking. Dualism, yin-yang, above below, they can't help it. They can't see the all, the one, the whole. They always have to divide. Because by dividing, they can participate. Divide and rule, that is their way of thinking. They give probiotics after a course of antibiotics. This is supposed to rebuild the good bacteria. These are, among other things, drinks in which bacteria are bred. Let's put it this way, through treatment with antibiotics, you can ultimately poison your body. Then you have permanent diarrhea. So, I go to the conventional doctor, who poisons me. Then, to be on the safe side, I also go to an alternative practitioner, who rebuilds my immune system. But this immune system doesn't even exist. I get ripped off twice. Here's a fact, about 100 trillion bacteria live on your skin, in your mouth and in your stomach. And, yet, you are not sick. Mercury in the brain. This is an electron grid image of the nerve cells of a snail. Now mercury is put in there, and look what happens. Do you see how the nerves retract? That is irreversible because nerve cells don't divide. Also, mercury detoxification is bullshit. It doesn't work. So, to be on the safe side, I go get a vaccination and I get poisoned. Thereafter, I go to the alternative practitioner and have the poison removed. What is an alternative practitioner charging me for, when the tissue is already destroyed? Finally, we reach the conclusion that the biological sense of the special programs themselves turn the whole of conventional medicine upside down. Until now, the whole world has always focused on the symptom. They have developed techniques and invested billions to get rid of the symptom. And then Hummer comes along, and is the first one to say, wait a minute, I need the symptom in order to solve the cause. I need the lump in the breast, in order to get the child well faster. Where do I have to start now? With the lump or with the child? With the child, of course. When the child is healthy, the weight falls off his mother's shoulders, and she spontaneously becomes healthy. This is the paradigm shift in therapy that we need. I don't need a radiation gun to burn away the tumor, I need the child to be healthy again. Then the mother will also be healthy, and then the lump will disappear all by itself. I don't need the radiation gun for that at all. And of course, I don't need the chemo battle gas either. Conventional medicine leaves out the psyche. It does not know the words individual or indivisible, and therefore wholly ignores the psyche. Excuse me for saying this, but it is incomplete. Unfortunately, many alternative therapy approaches do precisely the opposite and only look at the psyche. This is also just incomplete. We have 3 levels, the psyche, the brain, and the organ. Thus, we also have an overdetermined means of diagnosis, that is always synchronous. There is no organ disease without a correlation in the psyche, and also not vice versa. But this is no accident. This is precisely intentional. There is no misunderstanding by nature. The 5th biological law of nature tells us the biological sense of the respective special program, which we find in the active phase in special programs. The only exception is the deluxe group of programs. These are all those programs that have their control relay, and thus their Hummer focus, in the cerebral medulla of the cerebrum. In these programs the biological sense appears at the end of the healing. Let's take as an example colon cancer, yellow group. Here, the sense of the program is to solve the trouble, to digest the indigestible morsel. Or breast cancer, which has the sense of creating optimal conditions for the child to recover faster. Or loss of function, such as in diabetes, which has the sense of, to resist more successfully. Only with the connective tissue, is the biological sense at the end of the healing phase. The connective tissue is then thicker and has an improved function, afterward and for a lifetime. The biological sense of the old brain group is to increase the number of cells, which these tissues do in the active phase. The squamous epithelium also has its biological sense in the active phase, but achieves this functional enhancement through loss. For example, the bronchial mucosa widen through cell loss, to get more air into the lungs. The urinary tract dilates through cell loss, in order to better mark the territory with urine. In special programs that involve loss of function, the loss of function is the biological sense in the active phase. Otherwise, functional gain is always the biological sense. Only in the case of loss of function is the loss of function the biological sense, helping me solve my conflict and survive. The motor conflict is the play dead reflex. A rabbit, unable to escape, is suddenly paralyzed, and that is the biological sense of the motor program. If the rabbit appears dead to the predator may stall and abandon its prey, if it is not a scavenger, because prey that is already dead no longer needs to be killed. The 5th biological law of nature, which puts a biological sense in every special program, effectively is the therapy of nature. The 5 biological laws are in principle a formula to solve my problem, to solve my conflict, because the conflict or problem is the cause. Nature has already programmed the therapy into us. Isn't that wonderful? This understanding alone is super. I have the doctor in me. Meanwhile, even the healthiest diet does not solve a conflict for me. No remedy can solve a conflict for me. Now, some brilliant people will think, okay, I understand that no remedy can solve the worry conflict for me. But the healing phase could be reduced. Of course, that's just nonsense. it simply can't be done. I would be taking away the patient's recovery time by shortening the recovery phase. If someone has had an active conflict for a week, then he needs a week to recover. If he was active for 2 months, then he wouldn't get away with 1 week. He needs 2 months to come to health again. There is no other approach that works. We can't shorten a healing phase. I need the active phase of the conflict to resolve the cause, because in the active phase I am purposeful, focused on conflict resolution. I have obsessive thinking, and I dream about my conflict. Then, once the conflict is resolved, I need the healing phase to restore myself back to my initial state. Where am I really sick, then? In the active phase or in the healing phase? From the perspective of Germanische Heilkunde, the concept of illness or being ill is not clear. Am I sick in the active phase, which helps me to solve the cause? Or am I sick in the healing phase, when gather my strength and restore my initial state? So, the term sick just doesn't really fit anymore. As long as I was conflict active, I will also be in healing. This understanding is the best painkiller. We will discuss the topic of pain in the therapy seminar tutorial. Let's say I do not know now exactly what my conflict was. There's little to prevent me from stumbling on this issue again. But if I know that it was the neighbor, even though I cannot change this neighbor, even though he remains who he is, I can at least still avoid him. If I know that I will have a relapse again, every time I come into contact with him, I can consciously make sure that there is no more contact. Or if I can clarify the problem with the neighbor, so I know the conflict is really solved and will not come again, I am now in healing. I can know that I was active for a certain amount of time, and now I'll have symptoms of healing for a certain amount of time. Then I also have less fear. But in conventional medicine, nothing is known about these connections. The patient just has another relapse every time he has a dispute with his neighbor again. But now that I know, wait, I will never get along with the neighbor, and I will not change him either, I can be smart and just write him off and avoid him from now on. If I know why I have a symptom, then I usually know what to do to resolve the conflict or avoid recurrences. And when I have understood all that, I have less fear, which is what it's really about. Maybe none of us is a therapist, but this knowledge belongs to general education anyway. Once I have the diagnostic chart in my head and interpret the organ symptoms correctly, I have less fear, and therefore no secondary cancers that will be sold to me as metastases. Without getting any secondary cancers, I have the optimal chance to get healthy. Animals, for example, only have metastases in extremely rare cases. No one in conventional medicine understands this, because humans always have metastases. You understand why, now. Let's say your dog Jimmy has blood in his stool, and you tell him, Jimmy, you poor dog, you have cancer, and you're going to die soon. What do you think Jimmy does? He wags his tail and is happy because his master is talking to him. Animals are lucky, they don't understand the diagnosis. But you understand the diagnosis, and with the diagnosis of cancer, you panic. And your next cancer is a lung nodule. But if you understand what we've covered so far, when you have blood in the stool, you say, yippee, look here. I have a colon cancer and healing. Isn't that awesome? It sounds so unusual to say that blood in the stool is a sure sign of healing. Have you ever heard a conventional doctor say, oh, you're in healing now with your cancer? No? That's funny. And you'll never hear that either, although in conventional medicine, the term and phenomenon of spontaneous healing are well known. If spontaneous healing exists, this means that there must be a healing phase in cancer. There should be people who are in the process of healing. How else can there be spontaneous healing? But we are not told this. There also must be specific symptoms for the healing of cancer. Yet, this concept of a healing phase does not exist at all in conventional medicine. But now, if you know when your conflict was, you know how long you will have the healing phase symptom. That means, you see the light at the end of the tunnel. You can set yourself up for healing, like a challenging job that you have to do. I recently sent around a video about a patient I don't know. I don't even know the interviewer. The patient had blood in his stool and went to the doctor. The doctor painted the devil on the wall for him. He gave him 1 more month to live. But the patient had heard something about Dr. Hummer before, and just went home to look up my website. He knew he was in a healing phase, and he knew his conflict. He had bet a lot of money on the wrong stock and had really lost a lot of money. His solution was to swear that he would never gamble again. Because he knew how long the conflict was active, he could stay calm. He stayed utterly calm because, by knowing how long the conflict was active, he also knew how long his healing phase symptom would last. Then, he no longer had blood in his stool. The symptom was gone. This story was now 4 to 5 years ago. He conveyed it, sitting in the interview a strong man. They'd painted the devil on the wall for him with conventional medicine, that in one more month he would be dead. Yes, their business is fear. They first make us panic, and then they offer us the solution. That is dishonest, deceitful, vile. Nature does not do anything evil. The principle of evil does not exist in nature. Name me one malicious thing in that nature. It does not exist. And we are part of nature. If something happens in my body, then it is always sensibly arranged. If what Dr. Hummer says is true, then there is no contagion, and there is no evil. In the seminar tutorial on therapy, we will discuss this in more detail. There is no carcinogen. There is no substance that can trigger a sensible biological special program. There is no such thing. If all this is not true, then it frees your life. Don't you automatically have more quality of life when you are without fear of getting sick from the nasty microbes? So, we need an age of enlightenment in medicine. At some point, there will be a new era, before Hummer and after Hummer. At least as far as medicine is concerned, for sure. I want to point out one little thing. These tomfools, Hummer called them tomfools, these secondary literati who copy from Hummer, write that these are all ancient, archaic programs, millions of years old, and therefore they no longer apply today. Why does someone have to die of a heart attack just because he suffered a territorial conflict at work, and solved it after he retired? That's not appropriate. That's what some people write. But think of the woman who is 9 months pregnant. This pregnancy also proceeds according to these ancient, archaic programs. In fact, birth is the crisis. And women were pregnant for 9 months a million years ago, they were pregnant for 9 months 5,000 years ago, and they will still be pregnant for 9 months 5,000 years from now. I suppose that should no longer apply today. Why shouldn't we reduce that to 3 weeks? The tomfools need to realize, this is all nonsense. This notion of processes going out of date does not correspond to nature. Nature will not orient itself after us, will not conform to our social norms or our working hours or our current religion. Nature is always the same for everyone, and nature is always right. We must reach out to nature. To live against the laws of nature is not possible, and in trying to do so, you suffer. Find natural law in the living, not in dead matter. In the living is where Dr. Hummer discovered natural law. It is the expression of the will of creation once it so. Period. We don't have a picture of the Creator, but we can clearly understand the will of creation by knowing the laws of nature. And the better we understand the will of creation, the better we can live. In nature, with nature, from nature. We cannot live outside of nature. And nature shows us, Germanische Heilkunde shows us, how we could live healthily. No mother would give her child away to the creche for external care, while she goes to work. There would also be no singularization either, living as isolated beings. Nor would we have the glorification of pedophilia and homosexuality and so on. Well, I have nothing against homosexuality, I have something against pedophilia, a lot. But I have nothing against homosexuality, it's normal in nature. But I don't know any species in nature that abuses their children, I don't know that, and that's disgusting. Homosexuality is normal, it is not normal not to be gay. But the fact that it is glorified is also not okay. If we were all gay, then humanity would die out. It destroys the family. And our biology is the family, in the village. It's also the nation. Some would like to abolish all that. Some would like to keep us as animals are kept in factory farming. And that, of course, is not compatible with the Germanische Heilkunde. You can't practice Germanische Heilkunde in a pigsty. It's impossible, because Germanic is the medicine of freedom. We humans have to free ourselves again. Well, I have again preached enough. Ladies and gentlemen, I hope this was informative and enjoyable for you, and I hope you can use it in your life. I appreciate your participation and interest and would, of course, be pleased to welcome you here again. Helmut Pilhar, father of Olivia,